When you hear 24/7 RN coverage in every nursing home, it sounds like an obvious win for patients. But what does that actually mean in real life? I'm a doctor frustrated with the system. I'm just on a mission to understand it better and then share what I learned. And I've also experienced long-term care as a physician and as a daughter with parents in these facilities. So let's break this down calmly. The new CMS, that's Medicare, staffing rule requires 24/7 on-site RN coverage and 3.5 total nursing hours per resident per day, including about a half hour from that RN. In theory, more RN presence means you're going to have earlier detection of deterioration, better med management, stronger clinical decision making, and potentially fewer hospital transfers. That is the goal of this. And there is evidence that higher RN staffing levels correlate with better quality metrics in long-term care, including lower hospitalization and improved inspection scores. But here's what also happens. If a facility cannot recruit enough RNs, and many already struggle, they have three options: pay dramatically higher wages to compete, cut costs elsewhere, or close. If wages rise significantly in nursing homes, hospitals may have to compete harder for RNs. That can shift staffing pressures across the system, and we don't think that's going to happen. If facilities cut costs elsewhere, that could mean fewer support staff, reduced ancillary service, and tighter operating margins. And then if the facilities close, patients don't disappear. They either travel further from family, which is bad for patients. They end up boarding in hospitals. They can't get out of the hospitals. Or families attempt care at home, but they don't have enough support, leading to bad outcomes and patient and family burnout. Rural areas are particularly vulnerable. CMS acknowledged this, and they did put some exemptions into the rule. So the real question isn't, are RNs valuable? Of course they are. The real question is, does the workforce supply and reimbursement structure support this mandate nationwide without unintended consequences? Because healthcare policy rarely is about intention, it's about implementation. So if we increase staffing requirements without increasing sustainable funding and workforce pipelines, we can improve care in some areas with actually reducing access in others. That is the trade-off. And if you like healthcare discussions like this, follow along or join my weekly newsletter. Link is in the bio.